the introduction?
All right. Well, hello everyone, both physically present and on Zoom. I'm glad all of you could make it. You guys all know me, Dr. Stumpf. I'm not in scrubs. I know it's a change for a lot of people, especially myself. But we have a great opportunity. Dr. Zayd was in the and decided to stop by to spread the wealth of knowledge he has for hyperbarics. Now, one thing that's so special about this is that there's a lot of research out there. There's a growing body of evidence and research out there that is very exciting. But as any clinician can tell you, what you read in books and what you see in journals and what you see in real life is very different. The clinicians on the ground floor, they see everything. And Dr. Rantansi here has been doing this for over 20 years. Some of the early pioneers, speaking all over the place, all over the world. And he's considered one of the experts of hyperbarics. And he's been running clinics for all this time. So he has seen it all. So I just wanted to thank him. And I was going to say give a round of applause, but make sure you do it at home. There we go.
Thank you so
Dr.
much.
Zayd Rantansi.
All right, I'll make this really quick, only 5.5 hours, and you guys can go home or go back to. Okay, maybe not that long. Sleep is very important. Okay, so we're going to talk about hyperbaric oxygen therapy, and you know what? Chambers come in all sizes and shapes. The one on the left was my first chamber in Vancouver, Canada, not Vancouver, Washington, which I realized soon after there is a Vancouver, Washington, but it's Vancouver. Yeah, so we're only, 6 hours apart? And I started the first private hyperbaric chamber in Canada. There's about 9 chambers in hospital use. So you're right, Dr. Ben, I got an early introduction to hyperbaric oxygen. And when I started that chamber, there was only about, we didn't have access. So I had to get 5 hotels that contracted out 1 month stays for people to do this. You'll learn about this thing called a 40-hour protocol. And it's what we use in wound care. And we saw wounds heal before amputation. Just some amazing data. And I want to simplify this for you guys. So chambers come in all sizes. This one, I don't have a pointer, but you'll see there's tubes that are clear. There's low pressure chambers that are soft chambers, and then there's hard chambers as well, which Dr. Ben has both types, so you'll get to understand both applications. So they come in all shapes and sizes. This is what we use hyperbaric oxygen for, wound healing. In hospitals, think about this. That on the left picture was a wound that was about to be amputated, and in just 26 hyperbaric sessions in the hospital, you see the middle picture. Then on the right, you see after 50 sessions. What a difference, eh? And now, who did that? People will say in wound care, oh, the hyperbaric treated this, the hyperbaric didn't do that. The hyperbaric was a conduit. The human body did that. If you cut your skin, the skin heals. We have an innate ability to repair. And I want you to keep this very, very simple. And I want you to really understand the importance of oxygen. We get it from air that we breathe. We breathe in air, which is 21% oxygen. 21% oxygen fills up our red blood cells, 97 to 99%. If I put a pulse ox, 97 to 99% full, our red blood cells. We breathe 21, we breathe out 16 or something. We can't force all that in. We have a beautiful system. When air and oxygen goes down the lungs, it goes down the trachea and these tubes. finally to these little lung sacs called alveoli. There's 500 million alveoli because we're so oxygen dependent. What does oxygen do? Helps to generate cellular energy. And we know this because if we don't breathe for 5 minutes, then how much energy do we have? Even though we all say we have food for energy, we can't use that food. We are oxygen dependent human beings because we're energy dependent human beings. Our cells have atoms. Have you heard of an atom? Yeah? A central core of energy with electrons spinning around. Energy. Think we're all energetic beings. So of course we need energy, not just to maintain life, but then we need energy to fix things and do more. We need oxygen. That is the critical nutrient. You can take all the supplements you want, but if you don't have oxygen, you're not going to get far on cellular health because we need this nutrient. So the heart pumps oxygen through red blood cells. Red blood cells, you've heard of them, they carry oxygen. And one red blood cell, believe it or not, has the ability to carry 1 billion oxygen molecules. So think, now I want you to think of the size of a red blood cell to a tiny dot. Think of a billion dots on a red blood cell. So because we're so oxygen dependent, we need this nutrient. And so even that system, when blood goes to the lungs like a magnet, all this oxygen goes on the red blood cell, gets back to the heart pumps oxygen-rich blood, 97 to 99% full to the rest of the body. We're so efficient because we need this nutrient. You know, there's a tiny little amount that transfers into the liquid called plasma. Okay? So remember, the big red blood cell, and then some oxygen, 2% go into this liquid plasma. But guess what? 2/3, if you spin blood, you'll see 2/3 on the top right of the screen is liquid plasma. You spin blood, red blood cells on the bottom, and there's liquid plasma. We are liquid in our body. So the thing about hyperbaric oxygen, it's a simple gas pressure law of physics. You can't deny it. That's why we have it in hospitals. All it is, and remember this, it's more pressure, more oxygen gets into the blood, not on the red blood cells, in the liquid. So you're dosing liquid oxygen with pressure. Get into areas that might be damaged, inflamed, restricted in blood flow. And you just keep dosing every time you breathe, 12, 14 times a minute. Every time your heart beats, it's another dose of extra physiologically available oxygen going in the blood. So now think of this. That plasma oxygen just gets so high when you're in a hyperbaric chamber for 30 minutes, 60 minutes, whatever it is. You just have all this extra oxygen you would never get, but not on the red blood cell. My example is if we're in a room, which we are right now, the people on video can't see the open door, but if we're all red blood cells and they go into little, into arteries, arterioles, and into what we call capillaries, where they go one at a time, and the pH is really good, so they release all the oxygen. If we're all red blood cells, we go through the door one at a time. But if I filled up the room with liquid and cracked the door open just a little bit, we might not get through, or might squeeze through one at a time. But that liquid easily transfers to the hallway into other open doors. And that's what happens in a hyperbaric chamber. Free oxygen is everywhere in liquid. It is the easiest way to transfer the most essential nutrient into the body, into metabolically active tissue, to allow the tissue itself to have extra energy. Who's the best doctor? We said that. I don't know what happens when you injure yourself. We have the human body does things in a process, but we're energy dependent. So all we're doing is supporting the body to work at its physiological best in energy levels. And that's it. So that's the simplicity. One last slide I'll show on this example is you see on the left of the arrow, the red arrow, is where there was a blood vessel that's constricted. It could be aging, it could be diabetes, it could be a wound. Whatever it is, blood vessel is damaged. Aging, heart disease. So everything constricts. I call it LA traffic. Actually, here you can call it going across the bridge from Vancouver to Portland or vice versa, right? So what's happening is everything constricts. All those red blood cells have all the rich oxygen, and the tissue up and down is perfectly fine. Plenty of perfusion of oxygen. But as you pass through that bottleneck, there's not much red blood cells going through, or one at a time, not enough for the tissue above and beyond after that arrow. And what do you start seeing? Disease, injured tissue. And this is recoverable tissue, because what you see here is liquid plasma. See that yellow? There's liquid. There's not enough red blood cells. In a hyperbaric chamber, all the oxygen is in the liquid, and that oxygen in free form goes with extra pressure getting deep up and down, and all those diseased tissue start regenerating. New tissue, new blood vessels. If you look at hyperbaric oxygen, you look at the medical studies, you'll see something always what you'll see is something called angiogenesis, that's new blood vessels, and fibroblast collagen, new tissue. We're energy dependent. Now you can understand why this wound heals in 26 or 50 sessions. It's because there's liquid there, and you're just dosing in a hyperbaric chamber so much little oxygen that gets into this area, combusts with carbon energy, and now the area in that wound, the body can fix, can repair it. So I want you to keep that understanding simple. More oxygen, more energy, let the body do its own reparative processes. Not only is it in liquid, it's got extra pressure, and that's every time your heart beats. So people ask me, why can't I just put a mask on? Oxygen good, then we'll put a mask on. Well, you breathe 21% oxygen. If you put a mask, yeah, you might get more oxygen, but I said you're breathing out 16 and you're 197, 99% full. You can't force it in. So you're going to breathe out more. You'll breathe more in, breathe more out, so you can give better CPR, I guess. It's the waste oxygen, right? Pressure. We need pressure. This is, you can't bathe in the extra oxygen. You can't drink the extra oxygen. It's pressure. That's why we have these chambers in hospitals. It's a medically approved way to increase a physiological dose of oxygen into your body. Okay? Simple, right? Breathe in. Okay. So under pressure, more oxygen. So there's 6 real key physiological benefits I like talking. The first is, it's a simple formula. Combustion. You know, like you have oxygen and methane gas, and what do you see? Fire, right? And smoke. So fire in the human body is cellular energy. Smoke is what we call reactive oxygen species, metabolic exhaust. And both have a very important role intracellularly or within the cells. And the first is, obviously, you're going to get more energy, right? More oxygen, more energy. Less oxygen, less energy. It's a simple formula. That means better metabolism, and we tend to see blood sugars go down because we're utilizing sugar. as the combustible source. The second is that regenerative. Think about such an energy surplus. The bone marrow starts producing more stem cells. We're in regeneration mode. So when you do a course of hyperbaric oxygen therapy, you start getting into this thing called stem cell mobilization, new tissue, new blood vessels. It's a human body that wants to do that. It's almost like if you have LA traffic, what's the solution? Build new roads and housing, build new houses. But why don't we do that? Because we're on a budget. The human body is on a budget of cellular energy. So surplus of oxygen, relieve the budget, body's in wealth mode, body starts fixing. And that's the easiest way I could explain this, is energy surplus. Let the body do the rest. You know, I used to do a lot of therapies next to hyperbaric, try different IV therapies, different treatments, because I thought I was a doctor, and I realized human body is. The best I can do when you go into hyperbaric chamber is rest. Just like you have a cold or flu. Stay home for a day or two, and guess what happens? Your body rejuvenates. Imagine that rejuvenation with high oxygen in a chamber. You're putting both together, and you're getting extra energy for tissue repair, tissue regeneration, tissue function. Okay. There is a strong protective effect. You know, the first thing that happens when you get in a hyperbaric chamber, number 6 is enhanced cellular protection, antioxidant, and preconditioning. So there's so much combustion that the DNA needs, inside every cell, you have your own natural antioxidants. We tend to take antioxidants, or people go to, you know, the supplement, take antioxidants, but your body, your cells, your tissue have what we call endogenous antioxidants. We have our own antioxidant system, because when you have combustion, the DNA is fragile. So you have to have what we call a milieu, or internal amount of protection and antioxidants. So when you go in a hyperbaric chamber, you upregulate. And now every cell is more protected. Superoxide dismutase, glutathione peroxidase, and catalase, all these strong protectants. So that effectively is what happened in hyperbaric in preconditioning protocols. And we found, wow, you can go in a hyperbaric chamber and upregulate this protection, and don't do this experiment, but then go into a toxic environment or get a stroke or get some type of injury, and 50% less lesions, damage. It's because you are upregulating, you're protecting all the cells. And so there's some really good benefits of oxygenating all your body, so you're at your maximum of being protected in today's toxic and stressful environment. Then the most profound thing that happens after that is, from those reactive oxygen species, is this anti-inflammatory effect, a strong and potent anti-inflammatory. So, and that's within 2 to 5 sessions, we see a strong anti-inflammatory in our research studies. And how many times do people take anti-inflammatory drugs or medications? And it you know, this is one of the most natural ways to do that. What do we see with anti-inflammatory is pain, inflammatory pain. That's why a lot of people that are on medications, Ben, what percent of your pain patients do you give NSAIDs or anti-inflammatory drugs to?
At least the ones that are already on it.
Yeah.
That's probably 50-60%.
Yeah. And yeah, and they work, but they have side effects. That's the problem. But you have the most natural anti-inflammatory effect with, it's just not as easy as taking a pill. You've got to go inside the chamber. There's a time component to dose this. We'll talk about dosaging, but it's a very simple one. And the last one I'll talk about is immune system. You know, the immune system, it needs extra oxygen to kill. The immune system takes in oxygen, makes oxygen radicals bleach and peroxide, and that's how phagocytosis, it kills through oxidation. So the more oxygen, the stronger the immune system. And you see that as we get older, maybe less oxygen, not from the air that you take, but all the cardiovascular disease, the inflammation. And so there's generalized hypoxia, low oxygen states. And again, hyperbaric oxygen. Two things. One is relieve hypoxia, low oxygen, energy, that's number one. All tissue, all areas. But then the long term is there's such a surplus of energy, the bone marrow starts saying, hey, I'm going to create new stem cells. People go in for stem cell procedures that they pay for, but the body creates. You're always creating new cells. Hyperbaric is a stimulus for that. Well documented. 2006 was a landmark study that showed an 800% increase in stem cell mobilization. Then we looked, 2011, some great data tagging. Where is this going? In the brain, new brain cells, kidneys, liver, heart, new cells, regenerative. And I'm going to keep it as simple as possible. It's an energy surplus, and now you're in growth and regeneration mode. The body's doing all the work. The chamber doesn't do a treatment. The human body does. And all you're doing is putting in such a high energy mode that you're saying, hey, I'm going to take a little break. Like I got a cold or flu or whatever that is. I'm going to take some time to give my body such a surplus of oxygen and energy and rest and see what my body can do on this high oxygen state. And that's the simplest way for me to explain. So, the International Hyperbaric Association, I do training for them and the doctors, and there's indication cards. I'm going to simplify them for you. And, I put my 6 key indications, but they're really summarized into protection from the antioxidant, anti-inflammatory, repair from that increased energy, regeneration, which we talked about, the stem cell and tissue regeneration, and boosting overall performance. So every study I look at, whether it's for the brain or the heart or any organ or organ system, you're basically looking at those physiological benefits. Right now, the FDA doesn't approve hyperbaric for conditions per se, except about 14. But get beyond that, because those are 14 that are what we call hospital, severe, life-threatening. I look at it as, if it's that good for a wound that's about to be amputated, about any wound, a brain wound, anything. If it works that well, and we're reserving it as last line therapy, why wouldn't we do it as first line therapy? There's not enough access, cost, all of these things play a role. But should it? Like, it's such a natural, easy part of our medical system. We have it in hospitals, like I said, for 14 very serious indications. And if we understand those physiological benefits, those 6 key physiological and those 4 summarized, then you look at that and you say, man, this can apply to a lot of just human health support because of what we go through with injuries, with inflammation, just in general. Okay, so the internationally recognized, the 2 big ones that I see, stem cell and inflammation, I put them in big because those are the 2, and they're a base for a lot of this. So the International Hyperbaric, they have these indication cards you'll see back there if you come to the clinic. for those that are online. You'll see them, and they're supported internationally, recognized. Stem cell inflammation. Then neurology. I could tell you one thing. I started my practice and I have not seen neurological conditions improve so well with the support of hyperbaric oxygen therapy. And the main reason is when you're dosing hyperbaric oxygen, you're dosing it inside a chamber into the liquid plasma. The heart pumps liquid oxygen. Well, the brain is bathed by liquid cerebrospinal fluid. So all of a sudden, this liquid is getting high in oxygen and attention. That oxygen goes straight into the fatty tissue of the brain. Now the brain gets energy. Again, the best to repair the brain is the brain. All you're doing is transferring oxygen, energy, energizing the brain and saying, okay, now, whether it's a condition, Parkinson's, Alzheimer's, cerebral palsy, autism, whatever that is, you're energizing that organ so the organ itself can do its repair. I don't see anything simpler than that. And so in the medical research, I can give you the medical stuff. First thing we see is protection. Remember we said that neuroprotection, reduction of oxidation to the brain and inflammation. We call it neuroinflammation. Go down. Then angiogenesis and regeneration. Neurogenesis is new brain cells, new circulation to the brain. Don't you think that's going to help a lot of conditions that are centrally located, brain derived? You're not treating the condition per se. You're treating you're helping restore the pathology from that condition, Alzheimer's, Parkinson's, multiple sclerosis, whatever that is. I don't know. We get so carried away at putting a label to a disease or a condition, and there's so many similarities or commonalities to the process that caused that. It's like saying, you have a house and you have a rock and you have a brick and you can throw it, break the window. Window in one area might be Parkinson's, another area might be Alzheimer's, but what is breaking it? Reduce that, protect the window. There's so many things that we can do for supporting with protection and repair, and that's oxygen dependent. So that's why we tend to look at more. Now, one of the nice things is what you see in that upregulation of that circulation is not only stem cells, but neurogenesis and neuroplasticity. That's when there's damaged parts of the brain, with that surplus of energy, parts of the brain reorganizing and taking over the functional capacity of that. Being enough is brain-derived neurotrophic factors, and that's really important that we found in the regeneration of brain, and NGF is nerve growth factor. So lots of benefits for neurodevelopmental conditions, neurodegenerative conditions, and just neurological injuries. Alzheimer's, it's interesting. We always thought Alzheimer's, hyperbaric, the data originally was slow the progression and just don't, people progress quickly in Alzheimer's, just try to stop that, not get worse. And sometimes we see some improvement. Well, there's some really good data showing reducing amyloid plaque buildup and actually helping in reverse that whole application of Alzheimer's. So this is early research, and this is in severe Alzheimer's, but we have had a lot of data on early intervention for mild cognitive impairment before the Alzheimer diagnosis. And so really anyone that's looking at, tuning up their brain or has, is at risk for Alzheimer's or starting to have memory problems, then I really look into the hyperbaric physiology for that. Stroke, it's a natural, I think, for stroke, because stroke is a lack of oxygen, so the treatment should be oxygen. It's getting it quick enough, but you'll see in a lot of research, even 15, 20 years after a stroke, so it's never too late to get some of the benefits of hyperbaric. It just means maybe some more sessions per se. Traumatic brain injuries, head injuries, I've treated a lot of those, and even concussions, a lot of athletes with mild traumatic brain injuries, they're called MTBIs. And, the response rate again is the brain is so easy to get that dosing of oxygen. You don't need a high pressure. So we'll talk about pressure protocols. We have lower pressure that could be done in both a hard chamber and a soft chamber. And lower pressure protocols work really well for neurological because the brain doesn't need much. It's that consistent dose as the heart's beating to give that extra oxygen into the central nervous system. Okay. Same with autism. And with autism, there's a reduction in inflammation, especially in the GI tract. I treat a lot of cerebral palsy patients. The International Hyperbaric Association recognizes hyperbaric oxygen for cerebral palsy and neurodevelopmental disorders. Addiction recovery, there's a study that just came out that 5 sessions, that's on my latest hyperbaric report, 5 sessions reduce opioid withdrawal symptoms by 50%. It's understanding the benefits but with addictions, why pain, inflammation, think about the frontal lobe and how much some of the cognitive effects of what we call executive functioning. So in addictions, we really encourage people to look into hyperbaric oxygen therapy and we're going to talk about what a standard course is of that. Aging, the International Hyperbaric Association calls it anti-aging. I like to call it healthy aging, and it's just more oxygen, more energy for the eyes, ears, brain, moving, everything. Just think quicker, stronger, faster, whether it's immune system, whether it's the degeneration, macular degeneration, degenerative disc disease, osteoarthritis, all of these conditions where even skin elasticity, just having more oxygen, more energy for collagen and tissue. And cancer, when I started my practice, I never treated cancer because we had, when we talked about increasing angiogenesis, that's a word that doctors are really careful on in cancer because cancers, they grow through that process of angiogenesis. And so when I started, we always do safety first. So I wanted to see enough data and research. Well, it turns out the angiogenesis, the cancers producing more blood vessels and growing aggressively was through a hypoxic trigger, low oxygen. It was the low oxygen in the center that triggered them to start wanting to create new blood vessels, grow aggressively. Tumor hypoxia, you'll see that very well documented in the literature. So once we learned that, we felt, okay, maybe we could apply oxygen. So in the safety studies, they did application and they found it was safe. But in doing that, they found, wow, some cancers, 50% reduction in volume, brain, breast, ovarian. And then it's like, maybe we can add hyperbaric to cancer protocols. And that's where it stands right now. Whether we even have protocols for chemosensitization, radiosensitization. So there's a good level of evidence for utilizing hyperbaric oxygen dose related to incorporate with cancer treatment protocols. And also I already talked about the immune stimulatory effect. Your own body fights cancer cells by itself through its ability to kill cancer cells, so oxygen dependent. in that. A lot of work being done on COVID. The doors were open because a lot of the restrictions went out when COVID hit. They said, okay, you guys do studies. And New York University Hospital, you had so many studies done on hyperbaric to see, hey, can hyperbaric help? And I could tell you there's strong level of evidence of hyperbaric oxygen helping either in preconditioning the lungs, preconditioning tissue and body to preventing the disease or the disease progression, and also as an application when someone has COVID, COVID lungs, COVID anything, on reducing that severity. And you'll see it. The website, you might see it, hyperbaricexperts.com has, I don't have it on this, but we'll get it to you. It has all the research data. You can look by COVID or cancer, osteoarthritis, diabetes, whatever. You can search through that and it will show you the latest studies. But my only suggestion is, if you're going to do hyperbaric, early intervention. That's where we can really have, and think it's physiological support. Don't think it's a treatment for anything. Always think, I am supporting the body so my body can be stronger at fighting the virus or protecting from the damaging effects of the virus or any condition. So you're only supporting the body by being there. Diabetes is a disease or condition of the small blood vessels. Sugar goes high, spills in the blood vessels damage, and then you get nerves, neuropathy, eyes, retinopathies, kidneys. The biggest is the heart and brain. Heart attack, stroke are the two major risks for being diabetic. It's all blood vessel disease. So in a hyperbaric chamber, the oxygen, tiny oxygen molecules pass through where the sugars damage the blood vessels, gets into the surrounding tissue, and also helps the surrounding tissue regenerate and starts creating new pathways, new highways. So there's new blood flow. And that's the long-term effect. So anyone who has diabetes, someone says, well, I'm controlled now, diabetes. I said, well, how many years weren't you controlled? And how much damage did you do to your blood vessels? So I always like encouraging a course of for a diabetic to really look at a strong hyperbaric protocol to help just get the body back into physiological shape from the damages that were caused through the blood vessel disease. Lyme disease, infections, plastic surgery, just a lot of plastic surgeons using hyperbaric for accelerating and repair, less hospital time, less sick time, less infection, complications, and scarring, bruising, and just quicker, faster repair. For athletes, they'll use it in their training for conditioning, for mitochondrial energy, and just getting more trainings in a day. The more trainings you have, the stronger you are in your sport or activity. Pain and inflammation, a lot of contact sports. Without the hyperbaric chamber, it's they get injured, and it's really tough because they don't want to be on opioids or on any pain medications. But think about it, how damaging and painful some of these sports are. So getting into hyperbaric chamber and really helping to manage that. And not only that high oxygen, not only do we see quicker repair, but the type 1 to 4 collagen ratio is more tensile, so stronger tissue. So if you turn your ankle a year later, might not be the same when we do hyperbaric, just a little stronger. So helps to reduce the chance of re-injuring that tissue. So that's why a lot of athletes will use it. Also, they travel a lot, time zone, jet lag, and boosting the immune system. Obviously, concussions are a big issue with the pro athletes, and we have strong level of evidence and data on helping with concussion recovery. We have acute concussion protocols. If someone is injured right now on the field, it might be only a week of sessions. If it's 5 years, 10, if it's a long-term concussion protocol, we'll probably do a longer course, maybe 1 to 3 months, but that's it. and a strong recovery that we've seen for even sprains, tears, bone fractures, MCL, ACL, and then of course improving cognitive performance, reaction time, and being able to think faster, quicker. Dosaging, there's 4 variables: pressure, how much pressure, how much time, how much oxygen, and the frequency. If we're doing recovery protocols, I generally say 3 to 5 sessions is almost like a jump start. We'll do that for energizing the body, reducing inflammation, just a jump start. Pre or post surgery, that's a good protocol. 10 sessions if there's pain or an injury. 20 to 40 is more in that regenerative process. 40 is your standard prescription that we have for hyperbaric. You'll see that a lot, a 40 session protocol. And it's like taking a course of antibiotics. You do that. And most people, 97% of the responders respond by that 40 session protocol. So, someone has a major health challenge, infections, aging, degenerative conditions, I'll always recommend a script of 40 sessions. The 40-hour protocol, it could be dosed anywhere between 1.3 and 2 atmospheres, but daily. When I say daily, 5 days a week. You can do, clinics are open 7 days a week. I used to do that, and I found, 5 days is that 2 days off really makes a difference. So some people like Saturday, Sunday, other people like Wednesday, Thursday. I don't know what your clinic hours are, but 5 in a row, 2 off is a standard protocol that tends to work quite well, that we've seen good outcome. I tend to dose BID twice a day, see better outcome by having a 4-hour break and doing a second session. Not as convenient for people, but we do have good evidence in accelerated recovery from that. And I can't say that that's the only protocol. A lot of doctors in hyperbaric, physicians and protocols will just do once a day, and they'll still achieve that 40-hour protocol, but instead of me in 4 weeks, they'll do 8 weeks, right? It's as you start getting longer than that, then that's where the concern, we don't have enough data on that. It's like giving someone a bottle of pills and say, okay, here's 40, take them as you need it. It's dosed either daily or twice a day for that short period of time. Some people might require, if it's more neurodevelopmental or degenerative condition, they might need to carry that on. But if you see good outcome in that first 40-hour protocol, typically we'll evaluate 2 weeks after to see the before and after, and if there's good outcome and there's a plateau, then we might do another set of that treatment. So it depends. A lot of people, just that 40 hours is enough to, it just does a lot of energy for the body for that regenerative process. I'm going to talk about light therapy just very quickly. I got 4 slides of this and then we're done. And you'll see flexible light pads. NASA in 2001, I got this study, Dr. Maxfield, who I learned hyperbaric from, told me, get into light therapy from hyperbaric and combine the two. And this study showed a 36% wound size, quicker recovery when you combine the two. And they did Navy SEALs as well. And it was quite strong data. And then I realized in the chamber, I can't tell the oxygen just to go to a certain area. If you understand light therapy, you're targeting. So red light, you might have heard about it, red light therapy. Our body has photoreceptors. One of them is called cytochrome C oxidase. And that's where that cellular energy that oxygen combusted with carbon generates. So it's that energy cycle. So you're getting very similar effect in that, but locally. So in the chamber, I can't tell the oxygen just go to the wrist or go to the brain, but here I put a flexible light pad And it's this big focus in a certain area, and it's strong. It is really, really, really strong. And then the infrared, it's at a wavelength that just goes even deeper. And it also does that cytochrome C oxidase, but what that does is this blood flow. We call it vasodilation. It's a very short period of time that it just opens up a floodgate of blood flow just locally. And in blood flow, you get oxygen. So you're compounding that effect. So what you see here, microcirculation, is Dr. Burke at the University of Colorado. He did a study and showed in 20 minutes, that's a Doppler, and before you see almost no blood flow, and after it's a significant increase from 20 minutes of doing these flexible light pads. So now imagine doing it in the chamber when you come out of the chamber, and how that extra oxygen is in the liquid. We're targeting that dosage. So it's called targeted hyperbaric when you do the combination of both to improve blood flow, help to reduce pain, inflammation, same sort of stuff that you have with the hyperbaric, but targeted, especially that tissue strength. Remember we said the type 1 to 4 collagen ratio, we see a much stronger effect, and we can precondition tissue. One of the biggest things is pain relief locally. So if we do have pain, inflammation, or anywhere we're trying to increase tissue muscle performance, and that's it. So we sort of did that. How was that? You guys online? I'll open it up to some Q&A, because that's I don't know if we have any online Q&As, but anyone out here have some questions you want to ask? Yeah.
Wine.
Yeah.
I got one. And it's been kind of